work is all about improving health for patients. And of course, the best thing then is to involve the patients themselves and to create a better health situation when the care is given. So this is all being used in real time to follow up the data on the disease and on the treatment effects. And these are discussed between the patient who has the problem and the healthcare provider, usually the physician, but also nurses, who has the knowledge, the professional knowledge. So to combine the patient's needs with the professional knowledge and a measurement system, then you can really move forwards to create better health all the time. This is very new for both parties, since this is a cultural change, both for patients to be empowered, to take more responsibility for their own care and to evaluate the outcome, to understand what it means when they rate their pain on a certain scale. And of course to physicians to let the patients into the decision making at the clinical visits. So working together, they usually find a new way to use this situation to actually achieve better health together. The impact, of course, is the cultural change. And from that comes a number of things that the patients do feel more empowered. They really understand their disease and they can stay off care when they don't need care, and when they do need care they can sort of push for it to have an appointment very quickly because they can argue about it. And they can also understand that some treatments do not help them, so they don't need the expensive drugs if they already have a very low activity or an inactive disease. And they could also understand when they really need their physician quickly. And of course the physician, they learn to understand that they should ask for the outcomes of the treatments here and now and really change the treatments when needed. And also in combination, this makes the patients understand that they might need to take cytotoxic drugs or other drugs that seem to be dangerous. But when they at the next visit can see that they benefit from these drugs, they can usually continue to take them. The next challenge is that we are using for decision support now the patient's data, the physician's data and the laboratory data as they are, and they show that this treatment effect is good or it's not very good. And what we want to do is in this system is also to help the patients and the physician what would be the best treatment choice by predictive modeling. So we could model if the patient have an insufficient effect, what would happen if we increase the dose, if we change to another drug and which drug. So that is one way that we are working to improve this decision support. And another way that we're starting up just now is to add to these patient, doctor and laboratory data the research data that are existing in large research databases on the individual patients, as they give blood samples, for instance, for biobanking, and then they have researchers finding the biomarkers or the genes or other markers in their blood that could actually inform them and their physician on choices of treatment or risks for side effects, etc. So that is just starting up now to see how we could actually create a pilot for that. I think that the basic system of data collection and use is not really in place here yet. So you have large administrative databases that you could use for predictive modeling, and you have some databases that are on biologic drugs, for instance, in the rheumatic conditions. But now you have a new audit in rheumatology that might create a collection of early arthritis patients, and to use this patient group as a leverage to gain more data, more knowledge, and to actually improve the treatment of these patients, and also to detect them, to find them earlier than today. I think that the combination must be made of the top-down approaches that are very prevalent here in the UK. The NHS is big, the health department is even bigger, and they decide what's being done in the healthcare system. But you need to recruit the patients and the clinicians, the nurses, so they understand in which way they could contribute and benefit from sharing systematic data.